Welcome and good morning. Thanks very much for joining us for today's Integrated Health Service Plan webcast. As Ashley indicated, my name is Mark Britnell. I'm one of the Senior Directors here with the South West LHIN, and I'm also pleased to be joined by two of my colleagues, Kelly Gillis, another Senior Director with the LHIN, and Jeff Lowe, Board Chair of the South West LHIN Board of Directors. Jeff, Kelly, and myself will be part of delivering today's presentation on the webcast. Again, thanks very much for joining us for this important conversation and dialogue. It's the starting point of our conversation and information that we hope to share with all of you and others who joined us in the previous webcast we held 2 days ago. The purpose of today's webcast is really to share information with you around our plans for our development of our new Integrated Health Service Plan for 2016-19. And specifically in terms of today's content and agenda, we're going to share a number of points of information around the LHIN's vision and the planning and development and timelines associated with that. We want to introduce the concept of the IHSP framework, which is being used by the LHIN as a foundation for our development of our new IHSP. Talk a little bit about some of the determinants of health and their implications for the IHSP development and ongoing implementation. Talk a little bit about some of the draft work that we've started and to socialize that, and that will continue on as part of our broader longer term engagement on the IHSP development, and introduce some opportunities around feedback that we will be looking for from our health service provider partners as we continue to evolve the development and ultimately the implementation of the IHSP. All of this information that we're sharing is really going to enable us to talk a little bit about what we want to achieve in this next iteration of our plan, how we will go about understanding how we're getting closer to the vision that we will talk about today, and talk about things like our determinants, our populations, how our system, program, and project goals fit together, including how we will measure the progress that we're achieving, and ultimately talk a little bit about a framework that will enable us to transcend a number of IHSPs going forward in terms of ultimately reaching the objectives outlined within our vision. So at this point in time, I'd like to turn it over to Jeff Lowe, Board Chair of the South West LHIN Board of Directors, to provide some comments.
Thanks very much, Mark, and hello to everyone, and welcome to our session this afternoon, or I guess late this morning, on the next Integrated Health Service Plan for the years 2016 to 19. And certainly that goes along with a huge acknowledgement of all the hard work that's being done by all of the health service providers in the Southwest as we approach the end of the current health service plan. It really is because of your dedication, both as administrators and trustees, that we've had so many successes that we've had in the Southwest. And clearly there's still more work to do, and we've received the provincial message loud and clear. The health system is transforming, and we've got to transform with it to ensure sustainability for future generations. So that means it's up to us as the leaders to continue to focus our efforts to achieve the outcomes that we know are needed. And we believe, and we think you believe, that the Integrated Health Service Plan is that platform for change. We cannot be haphazard about that change, however. It has to be intentional and take a structured approach so we can go from where we are now to where we want to be in the future. And we need to support people and organizations throughout these transitions. So we need to be clear about the changes associated with the IHSP and what we're striving to do. It's not going to be easy. But in order to make continuous improvements, tough decisions will need to be made. You may face shifts in resources. There may be losses and difficult conversations along the way, and likely will be, but we'll persevere. We should feel confident that these difficult decisions are moving us closer towards our common goals: better health, better care, and better value for our friends and neighbors. So thank you very much, and Mark, now I'll turn it back over to you.
Great, thanks very much, Jeff. So on slide 4, we wanted to frame a little around the Integrated Health Service Plan itself, or the IHSP for short. And the IHSP is really our opportunity to outline strategic directions and objectives that will help us move towards and fulfill the vision that's been identified. It is our collective plan that includes the LHIN organization itself, but all of our health service provider partners. And we'd like to extend that collective plan to other provider partners that may not necessarily be funded by the LHIN itself. And really, it is an opportunity for us to build upon the accomplishments and the initiatives that we've achieved in the past plans, in the past years, as well as identify emerging opportunities of work that will take us over the course of the following 3 years. It does identify initiatives that all organizations, sectors, networks need to consider within your strategic and operational planning and efforts in order for the healthcare system to advance, to change, in order to meet the goals and the vision that has been identified. The graphic that appears on slide 4 shows you how consecutive multiple integrated health service plans work together over time to actually achieve the integrated health system of care that we'll talk a little bit more about today. It's important for our stakeholders, sector groups, networks, and governors, and generally the public to understand what's important around our healthcare system, the actions and the initiatives that are underway in order to make the changes, and how we will measure the progress that's being achieved going forward. We wanted to take an opportunity on slide 5 to talk a little bit about the Health System Design Blueprint, or the Vision 2022 as it's become known. This was a document that we put in place back in 2009-2010. So almost 2 integrated health service plans ago. But I think what's important when you look at what was defined within the Blueprint Vision 2022, the essence and the objectives of what were defined around an integrated health system of care still hold true. They still have meaning, they still have purpose, and are still relevant in terms of today's system, and more importantly, the efforts that the LHIN and our provider partners are working together to achieve. And so really will be a foundation for us as we continue on this journey to make the necessary changes in the healthcare system towards our ultimate objectives. We'll talk a little bit about the Blueprint Vision 2022 a little bit more in the presentation. In terms of slide 6, we wanted to take an opportunity to talk a little bit about the South West LHIN Strategy to date, how we are progressing and going about achieving results based on the vision that's been identified. As you can see on this slide, we have 2 graphs. One on the left-hand side is a picture of our strategy map, and I'll talk a little bit about that. And on the right-hand side is our Report on Performance Scorecard, or the measurements that we have in place to understand the progress that's being achieved over time. In terms of our current IHSP, it has 4 strategic directions and 3 key drivers. And as we move from IHSP to IHSP over time, we are getting better at measuring how we're actually achieving results against the objectives and the strategies put forward in our collective integrated health service plans. The left-hand side shows the strategy map, and that really is a foundation for the LHIN and our provider partners that has taken us over the course of 2013 and will take us into the final year of the current IHSP until March 2016. It really helps us align what the LHIN's mission, values, and key drivers and strategic directions and objectives are in order to achieve the outcomes that we desire. The Report on Performance Scorecard tracks that progress from a measurement perspective and identifies a number of key measurements, both from a high level as well as from a micro perspective, in terms of understanding how progress is being achieved, the successes we're having, and the ongoing challenges we may be experiencing. So those 2 elements together, the strategy map and the Report on Performance Scorecard, really are helping us build a foundation for improvement and sustainable change, clearly drawing out our vision, strategy, focus, the alignment of reporting, monitoring, and shared accountability, and the leadership to drive improvement. A reminder, our LHIN Scorecard is publicly available and is reviewed by the South West LHIN Board of Directors each quarter. Lots of conversation and dialogue takes place at our board table and within the LHIN team and with our provider partners on the metrics themselves, in terms of whether or not we're seeing progress and achievement in certain areas, taking the opportunity to celebrate those successes and those gains, but also having the challenging conversations about why we're not particularly getting the results that we're hoping to achieve in certain areas. On slide 7, we wanted to feature the 16 program areas that are currently part of our IHSP 2013 to 16. I'm going to take an opportunity to highlight a few of these program areas in terms of some of the accomplishments and work that's been achieved to date as part of the current plan. The first one I wanted to draw people's attention to is clinical services planning. Clinical services planning has been underway since 2013 in the following areas: stroke, cataracts, and endoscopy. We've worked hard to complete current state analysis to make sure that we understand each of these three streams. We've been able to draft directional recommendations that focus in on future state in order for us to evolve the healthcare system in each of those areas. Those future state recommendations were tabled and endorsed by the South West LHIN Board of Directors in March 2015. In addition, we've also completed some work in perinatal capacity assessment, and those draft recommendations have been developed as well. Another component of clinical services planning has been some work completed within the Oxford Hospital Joint Services Planning, and that includes implementation of recommendations related to pharmacy services, surgical services, and alternate level of care, or ALC as it's short form. In phase 2, which is underway, there's a focus in on laboratory services, mental health and addictions, and pediatrics and children health services. The final component of clinical services planning that I wanted to highlight is surgical waitlist management system. We wanted to recognize that it's important for our hospital partners to work together in terms of delivering surgical procedures, and there's an opportunity that's now being piloted within St. Thomas Algren General Hospital around looking at a system that all of our hospital partners may be able to benefit from. The second program area I wanted to highlight was emergency services. As everyone knows, emergency department wait times continues to be a key area of focus of the government, the ministry, LHINs, and our provider partners. The South West LHIN has undertaken a number of different strategies, one being the Pay for Results program, the second being the Knowledge Transfer program, and really what that was about is trying to drive emergency department wait times down. We have a leader within the South West LHIN being St. Thomas Algren General Hospital. We also have two other hospital sites being Woodstock General and Grey Bruce Health Services Owen Sound, who are performing extremely well. And those hospitals have been able to leverage the results they've achieved and spread that across other sites within our LHIN. Since 2012-13, we've been able to reduce admitted length of stay by almost 3 hours, or 11%, due to the hard work and dedication of our provider partners. The third program I wanted to highlight was Behavioral Supports Ontario, or BSO as it's become known. Really, this is an opportunity for our mobile teams, the Alzheimer's societies, adult day programs, and regional psychiatric program, regional psychogeriatric program. And this is really an opportunity to train people. There's been a lot of people trained across a lot of different provider partners. That enhanced training has been able to improve care and actually change practice as it relates to BSO. On slide 8, I wanted to highlight a little bit around our performance results. As mentioned earlier, we spent a lot of time looking at how we collect information and, more importantly, how we report out information. Slide 8 shows you a number of metrics that we use to measure our integrated health service plan. And you can see there that we're making progress in certain areas, and we also have some opportunities for improvement in others. Slide 9 focuses on a broader spectrum of performance results that are related to measures that we as a South West LHIN and all 14 LHINs across the province are held accountable for. And again, as you can see, since the time we've been working on these particular measures, we've made some success in certain areas, and we have opportunity for further improvement in others. In terms of trying to create some focus around our strategic directions, we did identify in our current IHSP 3 big dot measurements that we wanted to focus in on. And the one that I wanted to draw to your attention today is what we called Big Dot 3, or the increasing availability and access to community supports for people. The progress to date has been great. Our goal when we set this forward was to save 17,000 days from within our acute system. And as of Q3, the most recent result we were able to report on, we've achieved 16,144 days saved. So just an acknowledgement of putting time and energy and the dedicated work of our provider partners in achieving that result. In terms of the IHSP itself, we're going to provide some further content around the IHSP 2016. And at this point in time, I'm going to hand it over to my colleague Kelly.
Great, thanks Mark. And I'll just remind folks that to ask questions, as Ashley stated at the beginning, you can respond to the email that came out to you for the webcast, and we'll be answering those questions at the end of the presentation. So just moving forward then, looking to our next integrated health service plan for 2016 to 2019, we have been already working away here in the South West LHIN in what we've called our getting ready phase. And we have chunked out our work going forward into a number of phases. So we've been looking at emerging trends, what are the continuing directions within our current IHSP that we need to continue to focus on to achieve our vision and the outcomes for our population. And we've really started some early engagement with our Health System Leadership Council and our board-to-board reference group. And now we're moving into our next phase of broader engagement with partners across the LHIN to get feedback on our draft thoughts and the areas of focus that we've identified. Once we get that feedback and confirm that we're on the right direction, we'll be taking that to the LHIN board for their confirmation of direction. And then we'll be building out the detailed content of the IHSP over the summer months. In the late summer, early fall, we'll be validating our draft integrated health service plan with partners with the goal of having a draft IHSP to the LHIN board in October and the final IHSP to our board in November for approval. So we're reflecting again on our vision, a health system that helps people stay healthy, delivers good care to them when they get sick, and will be there for their children and grandchildren. We really want to emphasize the three key components within the vision. A focus on improving population health, improving experience of care for individuals and families within the LHIN, and achieving value for money. So to help us advance our vision, we feel it's important to identify a framework that we can continue to focus on here in the LHIN for consecutive integrated health services plans. The triple aim approach has been featured in previous IHSPs, but we're really now looking at how we can strengthen our approach and use this as a foundation for the next integrated health service plan, as well as IHSPs beyond that. The triple aim framework is really about achieving three things at the same time: population health, experience of care, and per capita cost. Those things clearly align to the vision in the Southwest LHIN and across the province. The triple aim goes on to talk about the importance of focusing on individuals and families, the need for effective primary care services and structures as a foundation to our healthcare system, being able to really focus in on a particular subpopulation to manage health and improve outcomes, ensuring that a cost control platform is in place, reinforcing system integration and effective execution of projects and initiatives, and building coalitions with other sectors. So the framework itself really speaks to us about the things that we need to do in terms of accomplishing our outcomes. The triple aim approach is also aligned to our health system blueprint, Vision 2022, which Mark spoke about. The blueprint describes a system which facilitates equitable access to service, better use of our resources, and better management of the health of our population, or overall improvement of the health of our population. And so again, we see the triple aim really benefiting us as an approach to help us achieve our vision. And how do we know if we're getting closer to achieving our vision? Mark talked a bit about the performance approach that we've taken here in LHIN, and I can certainly say for the time that I've been with the Southwest LHIN, I've seen a growing emphasis and ability for us to focus on performance outcomes and to have data and information that helps us to understand the progress that we're making. Our goal going forward then is to really ensure that for the current IHSP and future IHSPs, we can identify those baseline measures related to population health, experience of care, and value for money at a system level that we can continue to track over time to demonstrate our progress. Inherent in the triple aim as well is an understanding of the broader determinants of health. And this slide here really emphasizes the importance of understanding that the healthcare services itself are really only a small contribution to the overall health of a population. We know that people's health is largely influenced by the socioeconomic environment, culture, environmental conditions, where we work, where we live, our level of education, issues around income and poverty, all sorts of things, our social and community networks, as well as our individual lifestyle factors or behaviors, and not to mention hereditary factors that come along with each individual. So understanding how we work with our partners around influencing the broader determinants of health is also part of an overall strategy to improve population health. This model, focusing on equity at the top as an influencer to population health, is really valuable from our perspective. When you look at the left-hand side of the model, you can see that the emphasis on prevention and health promotion on the left, really relating back to upstream factors like our environment, individual factors like genetics and health behaviors, all of those things that influence the person are a large contributor to overall well-being and outcomes. On the right-hand side of the slide is more of the focus that we often see within our healthcare services, looking at medical treatments, looking at prevalence of chronic disease, understanding health and functional status, life expectancy. Some of our health service providers, like our CSS sector as an example, community supports, support services on the left-hand side that are more upstream, more about well-being and overall support to individuals. Many of the services that the LHIN funds are very much around healthcare treatment and services and healthcare delivery. Working across both sides of this model are how we're really going to achieve the best outcomes in terms of well-being and overall health and population improvements within the LHIN. So slide 20 is really looking at how we can use the triple aim to define our population and segments of populations. So in these examples that we provided, we're trying to demonstrate that the triple aim can be used at multiple levels. It can be used at an organizational level. So the example here within a long-term care home, if a long-term care home may be dealing with issues of incontinence around a certain population of residents, there's an opportunity to look at the needs of those residents and look at strategies that can help to achieve better outcomes with relationship to the incontinence issues that they're seeing. You can also scale that up and think about solving a health problem at a regional scale or a sub-LHIN scale. So the example we were speaking to here was work that's happened in the London Middlesex area, where mental health and addictions providers and partners have come together to develop a crisis service model that can better respond to the needs of individuals in this geographic area. And then we can also look at the triple aim from a broader geographic region like the South West LHIN as a whole. Mark already mentioned the great progress that we've seen through Behavioural Supports Ontario, and by focusing on that population of individuals across the LHIN with responsive behaviours, we've been able to look at developing a stronger system of care to achieve better outcomes for that subpopulation across the entire LHIN. We want to just take a minute now and talk to you on slide 21 about a program area of focus that we have been working on and we will continue to work on through our next integrated health service plan, again to demonstrate the principles around the triple aim. So Health Links, which many of you will be familiar with, is a broad provincial initiative which was really launched recognizing the fact that in Ontario, 5% of the population account for 66% of healthcare costs. And so there is a cost imperative when we think about how resources are being used to support individuals with the highest healthcare needs within our healthcare system. Here in the South West LHIN, we've tried to look at the population of individuals with high care needs to understand how we can influence strategies that will ensure better outcomes for those individuals. Using the Regional Integrated Decision Support System and looking at individuals with the top 5% usage of our ED resources and admissions to hospital for non-elective reasons, we've been able to identify 2,253 individuals with high care needs. We can then drill down and look at that at a sub-LHIN area, so in the Huron-Perth area where we've had our early adopter Health Link working away, 354 individuals were identified. And so again, looking at that subpopulation within our LHIN is our goal when we think about how we can influence the healthcare system to better benefit the needs and respond to the needs of those individuals. Slide 23 takes us even further then to looking at that subpopulation of individuals with high care needs in the Huron-Perth area. And we can start to then better understand their utilization of healthcare services. So looking at that subpopulation, we know that amongst those individuals, they were accessing services of health service providers between 1 and 7 health service providers. That amongst those individuals, we've seen 4 to 113 emergency department visits in the 2013-14 year, 2 to 23 acute hospital discharges, 0 to 9 discharges from adult mental health beds, And then amongst that entire group of individuals, we see that 81% of them are attached to CCAC services. And we know that the majority of individuals that we're identifying for health links do have a primary care provider identified. Despite the fact that these individuals are accessing the healthcare services, their outcomes are not what we would hope for the population. So we know there's an opportunity to do a better job by working together across the healthcare providers in our LHIN to affect those outcomes. And the other pillar of the triple aim is around experience of care, and that's where we're really looking at our approach to experience-based design and engaging individuals and their family members in telling their stories about their situation and how improvements can be made. So this example here is William on slide 24. William has had multiple complications related to COPD since 1994, many hospitalizations. He was actually admitted to long-term care at a point in time, but what William really wants is to be as independent as possible in his community. William was identified through the Health Links initiative in here in Perth, and they had his first coordinated care conference with providers across the here in Perth system in October. His goals were identified, and he really wanted to help care for his family and be an active member of his community. William and his sister are an important part of the overall team. William has identified that his individualized care plan resulting from this process makes him feel secure, and William continues to live in the community. So now I'm just going to turn, looking now at our next integrated health service plan, and hopefully we've demonstrated the value that we see in using the triple aim process as a foundation for the current IHSP and future IHSPs. We really want to have this framework for a number of reasons. One is so that we can transition seamlessly from one plan to the next. Historically, we have, I think, done our due diligence in ensuring that our strategies were aligned to provincial priorities or Pan-LHIN priorities, but as a result of that, we've reframed our IHSP each time we've created it. So it makes it a bit difficult to tell the story of the journey that we've been on, even though the underlying themes and the key areas of focus have been relatively stable throughout our IHSPs. We want to be able to work towards a consistent set of goals and measures in order to be able to demonstrate our success across consecutive IHSPs and strengthen our ability to plan, implement, and monitor and communicate our goals consistently over time. Again, the key focus back to helping people stay healthy, delivering good care, quality care to individuals when they get sick, and ensuring the sustainability of our system are the key things that we're focusing on, and using the triple aim to improve population health, experience of care, and value for money are our overall goals in helping us to achieve that vision. We want to be able to track system level data in a standardized way and use publicly available data to report on our progress. And through this process, we need to create a cascade of our priorities, our areas of focus, the projects that we're working on, the project measures that we're looking at in the shorter term to align back to our goals around population health, experience of care, and value for money. So moving on to slide 28 then, this is really a diagram that's meant to show that as we move through the development of our IHSP and drill down into the work that we're doing, in order to meet our overall aims, we are identifying a number of areas of focus. Within each of those areas of focus, there tends to be a number of projects or specific initiatives that are being worked on. We need to look then at the metrics associated with those individual projects and how they roll up to help us understand impact on population health, experience of care, and value for money at a project or initiative level, at an area of focus level, and then ultimately at that system level that we're really looking at in order to achieve change. So this next slide is our draft system view for our next integrated health service plan. So I'll just walk through that with you. It's slide 29. So the vision, mission, and values that we've continued to hold dear are at the top of the system view. The next level down, what will we pursue to achieve our vision? Again, population health, experience of care, and value for money. And there's a brief definition of each included on the system view. How will we measure our progress to achieving our vision? This is where we would spell out the specific measures that we would be tracking over time related to the three areas: population health, experience of care, value for money. So in the population health space, looking at broader well-being measures, in the patient experience space, using patient experience tools, survey results, etc. that are out there and now available to track progress. And then in terms of value for money, we've often used as a proxy things like hospital and ED utilization rate, overall cost of the population, etc. So those are the types of measures that we will be identifying through our IHSP development process. And then importantly, what will we do to achieve our vision? We will leverage enablers. So the enablers we've identified include health equity, quality improvement, integration, e-health and technology, accountability and transparency. We will foster collaboration between the South West LHIN, all health service providers funded by the South West LHIN, our primary care partners, and other partners not funded by the South West LHIN. And then we will focus on these particular populations: people who are frail and or who have medically complex conditions and disabilities, people living with mental health and or addiction issues, people living with or at risk of chronic disease, and our Aboriginal and Francophone populations. And then very importantly, so that people in the South West LHIN will have access to and receive high quality care regardless of their circumstances, have equitable access to culturally safe care, particularly for diverse populations, can make informed decisions about their care and for those they are caring for, have access to the information and services that will keep them and those they care for as healthy as possible, have care providers that work well together and are always up to date, are supported through their healthcare journey as their needs change, and know that their children and our parents will have access to the same or better quality of care in the future. So those outcome statements at the bottom are really key to what we're trying to achieve for the population of the South West LHIN. The next slide, slide 30, is what we're calling our focus on our areas of focus view. So again, we've restated the 4 population focuses that we've identified for the IHSP. And then the specific areas of focus that we've identified, in our past IHSP, we were calling those programs. So Mark talked about the 16 programs earlier on of our current IHSP. So these are the current ones that we've identified for the next IHSP. You'll see some have carried forward and some have shifted. So we have a focus on home and community care, chronic disease prevention and management, behavioral supports, hospice palliative care, acute care services, mental health and addiction services, health links, primary health care, and rehabilitative care, as well as the 5 enablers that I've already talked about on the previous slide. The way we identified these specific areas of focus was really, again, looking at some of our data and information around where we still have opportunity for improvement in our LHIN, looking to provincial strategies that are key priorities across the province, looking to ongoing strategies in the South West LHIN that have been a priority, and really trying to package those into these specific areas of focus so that we are working in an aligned way with the province and others in our LHIN. And again, we've restated those important outcome statements in terms of what we're trying to achieve.
Before we move into the next section, communication and engagement strategy, we just wanted to remind the audience that you have an opportunity to submit questions through the email account that was listed there on the title slide. So that is healthiertomorrow@lins.on.ca.
Thanks, Mark. And so we'll just wrap up by providing you with a bit of a summary around our plans for communication and engagement. And again, referencing that really from a communications perspective and with our current IHSP, our future IHSP, we see this as a call to action for all health service providers and partners to be working collectively in an alignment to achieve the common goals and outcomes that we have for the population in the South West LHIN. From an engagement and communication perspective, we're really wanting to target and actively engage with those individuals most impacted by the changes that we're envisioning within the system, and then inform all key stakeholders of the process and our overall goals. Our objectives are to capture a sense of how people using the healthcare system experience the system, to foster inclusion and build awareness in developing the IHSP for 2016 to 2019. And as always, we're really looking to achieve greater quality and quantity of feedback from the participants in our engagement process. One of the things that we're doing uniquely in the development of this IHSP was going really to those the individuals using our services and working with our health service providers to identify groups that they're interacting with And so we were very grateful to have ideas from a number of our health service providers around established groups of patients, clients, individuals, families, people using our healthcare system that we could meet with to get a sense from them of how they're experiencing the healthcare system. So we have a number of focus groups, some already conducted, some to be conducted still during the month of May and ones into June. And as well, we're rolling up information from a number of key initiatives that have already been using experience-based design as a key component of their initiative. So we have interview results from things like the Stroke Project, Health Links, initiatives around medically fragile people, mechanical ventilator users, our hospice palliative care work, and work with our Aboriginal and Francophone populations that we're also able to collate and theme and use as an input into our IHSP. And then as well, the results from the Provincial Patient Experience Survey, which was rolled out across the 14 LHINs, are now being received through the month of May, and we'll be using that as well to look at themes and opportunities as we develop the IHSP. The questions that we're asking in those focus groups with individuals using the healthcare system relate to their experience of the system around the quality of care being received, accessibility of care and services, whether they feel that services are sustainable, whether they're perceived to be coordinated across the systems and across the providers that they're interacting with, and whether or not as individuals they feel empowered to make decisions about the healthcare that they're receiving. We're also wanting to engage all of you across the South West LHIN through a SurveyMonkey process. So we will be sending out early next week to all health service provider leaders and as well to some primary care and public health partners a SurveyMonkey asking for feedback on what we've shared with you today in terms of the system view and the areas of focus that we've identified within the IHSP. We'll be collating the results that we receive back by sector, and we'll be giving those results back to sector groups through their co-chairs to enable additional dialogue if the sectors choose to have that, and an ability to provide additional feedback to the LHIN following that step in the process. So the packages, as I said, will go out early next week. Our goal is to have feedback back from all of you by May 15th, and then we'll roll that up and hope to have it back to the sectors early in June. And we're asking that each health service provider provide one survey response back to the LHIN. And then we'll be moving into a period of face-to-face engagement. And so slide 36 details our approach that we're taking. We're very much interested in gathering health service provider leaders and governors from across the system to come together through face-to-face sessions. These sessions are also open to the public to participate in these dialogues. Our goal is really to talk about change in the areas in which we see things shifting going into the future, and talk about what some of the challenges and opportunities might be around that change and what people see as some of the barriers that need to be addressed in order to overcome concerns about change. Information on these sessions will be distributed and is also provided on slide 37 just in terms of the dates and the locations that we're intending to travel to for these sessions. You'll also see that we've noted on June 24th a tele-town hall meeting, which will be another opportunity for widespread input into the IHSP using an electronic process. And then slide 38 just summarizes some of the ways which we'll be in building on our engagement using social media. So watch for hashtag Healthier Tomorrow, which we'll be using to promote dialogue at the face-to-face sessions and to amplify some of the feedback that we're receiving through our engagement process. We'll also be promoting our engagement sessions on Facebook and Twitter leading up to the dates, and there'll be live tweeting from each engagement session for those of you that are using Twitter. And we will be creating a homepage feature as well where people can go to see information around the IHSP. So how can you support the development of the next IHSP? Certainly the goal is to have you, all of our health service provider partners, your organizations engaged in this process, understanding your role and your responsibilities to play a part in developing the IHSP and then assisting with implementation of the plan going forward. And ultimately, our goal is to achieve a system that's integrated, sustainable, of high quality, where services are equitably provided and accessible, and people feel empowered.